As a plastic surgeon, one might question why we'd be involved in taking care of veins. We started with dealing with cosmetic veins, quite frankly, and deal with the small varicose veins or spider veins that women have in their ankles and legs, and sometimes larger veins. As board-certified general surgeons, though, we also were specifically and significantly trained in dealing with larger venous disease. A new technology called venous closure became available and really is a significant advance in the treatment of people with varicose veins. Instead of taking them to a surgical operating room and threading a device up their leg and basically ripping their vein out, which is a painful operation. It's painful not only to do, it's painful to watch being done, it's painful to have had done, and people have pain in their leg for 6 weeks after that procedure is done. It's also associated with a significant amount of time off of work. The procedure we do is significantly different than that. Instead of doing any cutting, we basically will use a needle, thread a wire inside of the vein, numb up around the outside of the vein, all here in the office under local anesthesia with some Valium as a sedation on board. We'll turn on the wire and the wire will deliver an energy directly to the vein. It makes the vein shrink and go away. The patient gets up and walks out of the operating room, actually our office operatory, and they go to work the next day. People are running in 3 to 4 days, they're swimming in 2 days, and they don't lose any time to have it done. It takes care of the aching and pain that women have, men too, in their legs. Probably 3/4 of the people we treat are women because they've had babies and their veins are stretched out, they're heavy, they're sore, and that creates the problem of heaviness. We tend to think that veins don't cause pain in medicine, but the heaviness from that blood pooling does cause pain for women. And so we're able to treat the big vein down the leg, and then we come along and do what's called secondary vein closure techniques like microstab phlebectomy. And microstabs, explained, is to take the smaller veins, smaller than the size of somebody's finger, that still might seem very large, but to take a very short incision and basically using a crochet hook, reaching in, grabbing out a segment of the vein, and again this is done under local, not at the same time as the vein closure, but we're able to now take a patient that has large veins in their leg, heaviness, achy and painful legs. We're able to shrink wrap the vein from the inside and then take care of the vein all the rest of the way, from their medium-sized veins all the way down to the very smallest spider veins on their feet, and even new technologies like radiofrequency vein treatments of the spider veins. We're able to really, from soup to nuts, we're able to really do total vein care so that people can come here and know that we can take care of them from the very largest vein to the very smallest vein in their leg.